All right, thanks so much for joining us, everyone. Today we are joined by Dr. Sonia Hariri. She is the founder of VIL Coaching. And are you zooming in from Arizona?
Yes, I'm in Tucson, Arizona.
Okay, and Dr. Hariri is dedicated to empowering dentists to identify their dental practice objectives and transform their vision into reality by providing dentists with the knowledge and tools for success. If you go to Deals for Dentists to find her promo offer of 20% off the first 2 life coaching sessions. So Dr. Hariri, you are a life coach, is that right?
That's right, Eric. I want to thank you for inviting me to this podcast and having me on your podcast.
Oh, it's such a pleasure because I think this is going to be such a great episode because I have so much that I want to ask you about your journey um, uh, with dentistry and how you help other dentists. Um, can we start off by you first explaining actually what a life coach is and what you do?
Yes, sure. So, a life coach really helps the individual find the place where they can go to and feel very comfortable and just talk and say everything that they really want help with. It's a safe space where people can feel very safe. Everything is going to be confidential. But I want to say, most important, it's a very non judgmental space. So people don't ever feel like they have to hold in something because they're being judged. And so when when I do the life coaching, I see how people's faces just light up towards the end of the session. Another remark I get, oh, I had such a heavy weight on my shoulders, and now I feel like it's all gone. And that just gives me so much joy when we reach that point with the client. It's amazing. It's such a great experience. And I just enjoy seeing that in the clients that I help. So it's about really trying to find the solution yourself. What we do in life coaching, we help you arrive to the solution. 80% of the time, the client is talking, and 20% of the time, I am coaching. And the client, they really find the answer because it's within them. We're not telling people what to do. As a life coach, I am just helping them because they have everything in them to that solution. They have everything in them to succeed in whatever it is that they want to succeed in.
So you're more of like a guide. You're guiding them to almost help themselves, and you're also a dentist. So that's a great combination because you're a life coach, but also a dentist. So you've walked in their shoes. So that's I think very important.
For sure. Yes, Eric, I've been a dentist for 30 years, and I know as a dentist and a private practice owner, all of the business challenges that come along with the practice of dentistry. So I really can relate to the stories. I can relate to how, when you go home, it's really not the same. You can express about your day, and if you had a rough day, you can express about it. But for people who have really not been in our shoe and walked that path, I think it's very hard for them to relate to what we as dentists experience and go through and deal with. Dentistry is a
It's so
great
true.
profession. Yes.
It's so true. I went through um, finding a therapist. I just went through you know I just Googled and I found a local therapist. This was about 3 or 4 years ago. Excellent therapist, but not a dentist. So it's dentists just know each other. They get it. We get each other. We've been through school and the day-to-day stresses of the profession. And I remember I was talking to my therapist and I was going on this, emotional rant for about 20 minutes. And I was talking about, the business and the staff and all the HR and dealing with patients. And I went through this long emotional rant. And then she said to me, wait a second, so what does the office manager do again? And I'm like, this is just, it's just so different when you actually can uh, talk to a dentist. So I think that's great.
Yeah. So I want to really clarify to the listeners the difference between a life coach and a therapist. Life coaches really work with a client. As a life coach, I work with the client to help them with the now and the moving forward. Therapists help with clients with issues from the past, from their childhood, some experiences that affected how they do things today, some experiences that are holding them back. In life coaching, these topics do come up, and we also help the client realize that that is still not a reason to hold them back from being able to do what they want to do. So there is a real definite distinction between a life coach and a therapist. And sometimes a life coach will team up with a therapist because some individuals might actually need to work with both. So I really want to make that very clear to the listeners as to how. So when you said you went on talking for 20 minutes, as a life coach, that's what we love to do. We love to be focused and zoomed in completely on what you're saying. We actually hear you and we listen to you 100%. And that's how we help you move forward with that issue that's really bothering you. That's what you are expressing and talking about. And oftentimes, Eric, what the issue that comes initially, oftentimes it is not the real issue. There is an underlying issue that just was not clear to the client. And we bring all of that to the surface. And that's how the client finds the solution, essentially.
Now, how did you become a life coach? What's involved with the training that goes along with it?
So with life coaching, you have to do 60 hours of life coaching school. And that's what I did. So the training I did was 66 hours. And then you actually get clients that you start coaching and they coach you. So you can set that up through the school, or you can find it through the ICF website, International Coaching Federation, as a coach and as someone who has completed those hours of classroom training. You can also do that. And so I started that way. And then I was coaching dentists or other people who needed life coaches that were not dentists. Actually, initially, I started just giving them my time voluntarily to build up my coaching hours. So that's how I got started. I had been coached through the Pride Institute in my career for 16 years. But the life coaching is completely different, or I would say a good portion of it is different. I can say that being a coach and a consultant, because as a consultant, you most of the time are giving advice. As a life coach, the individual finds the answer. We co-create the answer together, but you are the one choosing that goal. You're choosing the next step as the client. And that's how there is the distinction between coaching consulting and just life coaching. I was coached and consulted. I was not using a life coach. I didn't know what life coaching was about until last year, actually.
So you actually, you're both, you're a coach and a consultant. So if you're, starting the coaching process and the dentist is talking through these issues, and you find that a lot of these issues are coming from certain systems at work, um, or business decisions, then you could actually combine the two and help the client not only with coaching them through their issues, but advising them on certain business practices or systems in the office, and also as a consultant.
Exactly. And the reason I like that, Eric, is because then it is not a cookie cutter approach. If people are just needing help and finding that they're stuck in a specific area, then, we can customize the coaching and consulting accordingly. So I'm not going to I'm not helping dentists and saying, this is how we have to do this. This is where we start. The client is the one who chooses. And we co-create that plan. And we set smart goals a little bit at a time. And so that's really the difference.
So do you start with just a consultation typically, and find out, and then so it's not cookie cutter, like you said, you kind of customize it for what that specific dentist needs. But then do you find that as you're coaching these dentists, that from there you find out that they actually need more consulting help, or vice versa, where they're coming to you as a consultant, and then you find out that you want to also combine your coaching?
Yeah, so that's how we start. We start with the life coaching, and I ask them, I have like a half an hour initial meeting with them where I want to really know from the dentist or the client, what is it that they're really wanting from me and what they're looking for in using a life coach or a coach. And so I want to make sure that I am going to benefit this client 100%. And so I then, see if we are a good fit. And if that's how we both determine that's what it's going to be, then we move forward. And oftentimes, until we've actually had some coaching sessions, we really don't come to what is the real underlying issue. It takes one or two sessions where we really find what the true underlying issues are and what's best. I also want to say that, Eric, with the life coaching, I'm also offering it for the dentist team at a very reasonable fee. Because oftentimes, I also do a lot of leadership and leadership training. And oftentimes, we divide that into two areas. It is either an adaptive challenge or actually a technical challenge. So when it is adaptive challenge with the team, where we're being challenged with a team member, really the problem is within that team member. If the team member is not willing to make a change, then really we can't move forward with whatever the challenge is, and we can't solve the actual challenge. And therefore, I am offering my services to my clients also to help their team, also through life coaching, through finding what is it that's making that individual stuck in that way. I'll give an example. And being a dentist, I can think of examples and scenarios and situations that either occurred with me or with my clients. For example, a hygienist who just does not perio-probe. And the hygienist, the dentist will have a conversation with the hygienist about, it's important to perio-probe. It's basically malpractice, and we are held accountable and so on. So these individuals, sometimes a team member is just so used to something, and making a change is a big deal. So we work with these team members in really helping them figure out what is stopping them from doing that, what gets in the way. And that's where, I help the clients, the dentists, the teams, if they need me to work with a team member. I also am designing a course to help managers and dentists coach the team. We have always been used to being told in dental school, we're told what to do. We come out to the real world, and in practice, we are the leaders, the owners of the practice. We're looked at as the authority. Our team comes to us for solutions, and they want answers for just about every question they come up to us with. And so we have gotten used to, it is our responsibility to give the answer. We have to have the answer. And we're not trained to coach our team to find the answers. And that's really been an area of passion for me right now, where I want to work with dentists to help them become better leaders and better managers through that coaching style of their team versus giving every team member the answer. And team members get upset when we don't have the solution. I had the experience of interviewing a dental assistant a few years ago. And in the interview, I asked her, I said, so why are you leaving your current position? Her answer was, I have been with doctor for 15 years. Our hygienist retired, and the new hygienist and I are not getting along. And I mentioned this to doctor a few times, and he's not doing anything about it. And this happens in many practices where there is team conflict. People aren't getting along. And it is so sad for me to see that happening as a practice owner, as a dentist who've owned practices for more than 27 years. When I have a team member that I have been working with for 15 years, who I have built a lot of trust and confidence in, and she really knows what to do. She is so like a right hand. And to lose a team member like that for a conflict issue that is not being resolved the right way is something many of us have either experienced or are experiencing or will experience. And really, when I retired from clinical dentistry, and I have been a clinical dentist for 30 years, that was an area I wanted to work on, that I found that nobody is really addressing in the way that I want to address it. I have been coached and consulted, and there are people who stand on the stage and call us controlling, as they are speaking in the room. They say dentists are controlling, dentists micromanage, dentists this and that. And really, if you were to ask any dentist, we don't want to be controlling, we don't want to micromanage. This is really not what we want to do. However, I would say I've created those courses to help dentists not fall into that trap of micromanaging and undermine their leadership, undermine their management skills. That's an area that I am now focusing on heavily, and I'm putting a lot of weight on. And of course, life coaching is helping with that too. Because with life coaching, you're really empowering the individual, the client, by finding the answer. And that's what it's all about. It's if we as leaders and managers can empower our team in how to handle situations and how to deal with certain issues without having to come to us, then really our managing is minimal. We're having to manage less. We have to step in when problems arise. Otherwise, we're doing very little managing and leading.
Oh yeah. What would you say the common denominator for if I was to call you is and seek your coaching services? Is it because I'm stuck, burnt out, stressed because of staff management or conflict at work? What is the typical reason why a dentist is calling you for your services?
So it's really all of the above, Eric. And like I said, we face different situations at different times. So we face many of the ones of the problems, and many of us dentists face the same issues. But oftentimes it is what is the pressing issue right now. So it's different for every client. And sometimes it could even be a personal problem that they are dealing with. Sometimes it could be a financial situation. And I love working with that too, because I am just naturally good with numbers. And I find that an area that also has helped other clients and dentists with seeing things, because oftentimes, like I mentioned, Eric, you may be stressed about something, or individual may be stressed about a situation, but in actual fact, it could be some financial pressure that could be the underlying factor.
So
And
I may call you and I think I'm having, is it typically stress? So I'm calling you because I'm stressed and I feel stuck. I think it's because of this, but you may actually find through your coaching that we uncover that it's from something completely different.
exactly. And maybe you're really not sleeping well at night. Maybe you're having difficulty with a team member and you just are not sure how to handle that. And so sometimes it's minute things that really get in the way, and we may just not be aware of what the real issue is. And that's what I help them with.
So you're someone looking in from the outside,
Yes,
because a lot of times, as you know, dentists, we're stuck in our own little bubble, especially the solo practitioners. You're stuck in your own isolated little ecosystem, and you may need that help from an outside coach that can look down from 30,000 feet and figure out what the real issues are. Now, I really liked the team coaching aspect that you provide, because a lot of consultants, they just focus on the dentist,
yes,
um, and you know I say, a happy team makes a happy dentist. So if you can help kind of de-stress the team, that's going to be less stress for the dentist. And we don't come out of dental school with any HR training. So how are we expected, like you said, to have the answers for these questions when we aren't trained for this? So that I find is uh, a very stressful aspect of the profession is that we become entrepreneurs and business owners, but with no business experience, no HR experience, and our staff is coming to us looking for answers, and a lot of times I don't have the answer. So I think that's you really hit the nail on the head there with that one.
And you know, Eric, the sad part is they aren't aware that we're not trained to manage and lead. And they have a very high expectation of us as practice owners to have these answers for them. It is not something I can tell my team, well, you know, I really can't deal with this because dental school didn't train me to deal with the conflict that you are having with the hygienists. You know, they come to us and they want the answer. And if we don't have the answer, they get upset and they leave. And the problems even get bigger before they leave. And so, I mean, I know what it's like. I've done this for 30 years. The other thing I want to say, Eric, let's take the analogy of why it's so important that the team learn a lot of the things that the dentist is also learning. Let's take the analogy of going to an implant class. For the first time, you're going to place implants. You've never done this. So you then start investing in the system, the dental implant system. We are now having to train the assistant on how to use the system. It would be impossible for you to do the implant procedure without at least sitting down with your assistant and giving her some training in how the drill system works, what you're going to be wanting in terms of the drill sequence, how you either are going to use a cover screw or a healing abutment. You know, if your assistant isn't aware of even the impression coping parts, what's going to go to the lab, if they don't have the knowledge, it's impossible for you to do this start to finish without sharing that with the assistant and giving her that training. So we do this in dentistry when it comes to technicality all the time. And it is impossible for us to function with our team, whether our clinical team or the administrative team, if they do not know what we know in terms of at least within the parameters. I mean, we're not teaching them dentistry, but we are teaching them certain parameters that they need to know. And therefore, when it comes to these communication parameters, how to deal with each other, how to communicate, and how to really find solutions to some of the challenges that they will be facing in working together, we have no parameters set up for our team. And that is so important and crucial. And boy, will that make our work so much easier when we all are speaking the same language. Imagine if I were to tell my assistant, I want the cement, and I don't tell her to give me the Reliance. You know, so this is where I find there is a gap in dentistry. And I really have decided that this is an area that I want to really take on and work with. It is very hard. It's a more difficult area to work on and with than actual clinical and technical stuff. But I really want to work with this, on this with my clients, with dentists, their teams, because I find this is going to be so beneficial. That's my purpose. You know, when we do something, we say, what's the purpose? And if we don't have a purpose, it's extremely hard to really be passionate about something. I'm extremely passionate about it because I see that the purpose is just so good and beneficial.
Now, what are typically dentists, are they, when they come to you, are they burnt out? Are they dreading going into work every day? Like you said previously, they feel stuck, they're stressed. Is that the typical dentist that's calling you?
Yes, yes, that's really the typical dentist, Eric. They're really seeking help because obviously, the definition of insanity, you keep doing the same thing and expecting different results.
Yep.
And therefore, they really are looking to get out of this vicious cycle.
Hmm.
If you don't mind, please, I just want a drink of water. I am in Arizona and it's very dry here.
Sure. I think that is, what you said about the word insanity, doing the same thing over and over. That is what led me to take action, personally, for my situation. And I transitioned to become a partner in the practice that I was associating in. And I was shot out of a cannon and wanted to make all these changes because I had listened to so many podcasts. I'd been on Dental Town. I had been to so many courses, and I knew there were so many better ways and more efficient ways that I could help the practice go to the next level. But I didn't explain the why to the staff. I just expected them to do all the changes that I wanted to do in a very quick period of time because I was the boss and I was doing this for a reason, but I didn't explain that reason. I didn't explain the why. So I think that change can be very difficult for people, especially a legacy staff that's been there for a long time. And if you don't explain why you're doing something, and the reasons behind it, then your staff is not going to get on board and you're going to be stuck again. And so that's what led me to say I needed to do something. I needed to take action. I was getting stressed. I was full of anxiety and burnout. I dreaded going into the office every day. And it was all the stresses from the office, becoming the new owner, and the pushback I was getting from the staff. And I said, I can't keep doing this for the next 30 years. I need to get some help mentally. So I started seeing a therapist. I did a lot of changes, a lot of soul searching, and just really kind of took a slower approach and looking, more at myself in the mirror and asking myself, was I a good enough leader? And when I do institute a change, to make sure that I explain why and get everyone on board before I try something different in the office. So that was my story.
Yeah. So on the change, what I really want to share with you and the listeners is that in my leadership studies, what I learned is that people aren't actually fearing change itself. What they fear is loss. In change, they see themselves losing something. For example, when we use a new dental software, the fear is they're losing that comfort level with knowing the software, knowing how to navigate through it. And then we're gonna now take this away and bring a new software. So they fear that loss of, well, I'm not gonna know how to do this. I'm not gonna know how to do that. So that's just an example of change.
Mhm.
And why our team, or some team members, not everybody, depending on their behavioral styles, which is something that I also found very beneficial as I did the certification of DISC, is that behavioral style matters as to how people handle change or handle challenge or problems and so on. So that's another topic that I teach, but
What is DISC? That's DISC.
yes, so DISC is behavioral styles, and typically most of us exhibit two behavioral styles that are very evident. These are styles that we can see in an individual in how they behave. And so the behavioral styles of individual matters in how they do things and how they, for example, I'll tell you in DISC, the letters stand for dominance, influence, consistent, and compliant. So the C is compliant. Someone that's a high C in DISC, they're very good with systems, they're very good with accuracy, they are very detail oriented. Those are individuals who do very well in the front because you're dealing with patient ledgers, accounting, you're having to deal with insurance, the posting of things. So when they pay attention and are very careful, that's an area that they're naturally strong in. And therefore, if you hire a team member who is a low C, who is naturally not strong in being detail-oriented, accurate, accuracy matters, quality matters to them, then you are having to ask something of them that is not natural to them. And that puts a lot of stress on that individual, because if we are functioning within our normal behavioral style, which we call the natural behavioral style, and we're not having to do huge shifts, then we actually do well in that position. So that is something that I have really learned in the last year that is so beneficial. And I tie all of my knowledge, experience, and training when I talk to dentists, when I talk to my clients. And this is something I want more and more of dental teams to be aware of, because we tend to be judgmental. We tend to say, why doesn't she get this? I mean, I have shown her this 3 times so far, and she still can't get this. Well, as Jim Collins said in his book, Good to Great, get the right people on the bus and put them in the right seat. And that could not have been more accurate. He said, people are not your best asset. The right people are your best asset. And so this is something that is very important for us. A lot of organizations use DISC assessments and DISC profiling before they even hire. And they use it for their existing team members, because if you don't know what DISC profile your behavioral style, your team members are, and you want to replace them, then it's going to be hard to, and we've made those mistakes. We hired great people, and after the 90 days, we just say, we keep trying. After the first month, we say, well, we just kind of don't want to admit that it's not looking like they're the right fit, but they are great people. And we often wonder, why? So this is really why this great individual is just not fitting in this position. And then when we put team members to work together, there's another certification that I did that's called 12 Driving Forces. And that's what motivates people based on their beliefs, their worldviews, their experiences, and their values. That's huge. So, for example, in the assessment, we can determine if you put 2 people in the front desk, one is very tidy and the other one just likes to work in an environment where there is clutter and it doesn't bother her. That creates a lot of stress for that individual who likes it very neat, a clear desk. And so there will constantly be stress for one individual, and another individual is not really able to be that neat, tidy person. So these are all things that can be shown in the assessments. The assessments are questions that the individual will choose to answer the way they normally would do things. And therefore, that helps us as managers, as leaders, really know how to find good teams to work well together and how we can address each team member within their style. I want to say there are team members who are very abrupt in the way they talk. They're very task oriented. And for task oriented individuals, which sometimes I will say, I personally fell into that trap because I tend to be a high SC on this. I am a high SC. And so a high C is task oriented. Sometimes we often focus on the task and we forget about the emotions about that individual. And we're so focused on task, and that individual, their behavioral style may be high emotions is high for them on their behavioral style. And therefore they could feel like they're just not receiving the information well.
So, it sounds like that's such a great idea to have either a new hire or during an interview or your existing staff members take these assessments, because you may be looking for someone to answer the phones.
Yeah.
And if they're not scoring well on communication or the results that show that they would be a good fit for the phones, and they're a better fit for dealing with insurance companies and the numbers, why are you going to force that person into a job where they're taking phone calls all day? It's just not going to work out well.
Exactly. And
So I think
are going to feel it on the other side. They're going to feel like, well, it was hard to communicate with this person. I didn't feel like they were really that friendly over the phone or warm, etc. Absolutely, absolutely.
now you mentioned you practiced for 30 years. During your years when you were practicing, did you ever suffer from burnout or stress or anxiety?
Yeah, so burnout, anxiety, stress, I would say I have experienced in my 30 years all of the above. And what I found with burnout and to avoid burnout is to take vacation regularly. And by regularly, I would say take some time off every 2 months. Just go, come back rejuvenated. Do whatever it is that makes you de-stress, whether it's a short trip to the beach, whether it's to the mountains. Everybody finds and knows what that is for them. And therefore, I found by doing that, it helped me come back fresh. And I felt that as I was working and things get tough, I was looking forward to that time where I was going to de-stress. Of course, some of the stressors are turnover. Turnover is always one of the hardest situations. And if we have a small practice, it becomes even harder. If we have anywhere between 5 to 16 members, because by the time we're given notice and we're hiring somebody new, there is really not enough time for quality training. And that's an area that also I have found solutions for with offices to help expedite that process. But that's always having a new team member, training a new team member. Turnover was something that definitely, sometimes even a team member just calling in sick, and you have a schedule that's scheduled for 2 assistants, and now you're having to work with that one person only or having to get a temp who doesn't know your office enough. So these situations obviously do cause additional stress. Sometimes it could be a really just hard patient in terms of not being able to open their mouth wide enough, visibility, access to an area, um, you know, gum bleeding, excessive bleeding, etc. So we have to manage that a little bit more, puts us behind. That causes some of our stress throughout the day if we're running behind on our schedule. Then we may get an emergency call that day when we're running behind. So, just our days aren't the same. Not every day is the same. So definitely, I would say these were some causes of anxiety, stress. One of the areas that I also know that people deal with and experience stress from is when financially they're stretched. And that is an area that is definitely a high stress causing area. I would say initially in the beginning of my career, when I started my first practice in 1990, Eric, the interest rate that I got was 12.99. And so financially, I felt stressed because it was a startup practice. I had these bills that I had to pay and meet every month. And so that was causing me anxiety early on. And it did something good to me on the other hand, in that it taught me very early on in my career to be very careful with spending and to budget very well and to watch finances very well throughout my career.
Now, did you have a strong support group when you were practicing with peers? Because that can be a major factor, where, especially a solo practitioner, to reach out and engage with your peers, whether it's through a study club or now it may be all different now because it's all virtual. Did you have a strong support group when you were practicing?
It was in 1990. I did not have a strong group. There was no internet.
Mm-hmm.
I did not have a support system. I also was a new mom, and therefore I was also struggling with juggling the practice ownership, dealing with being a brand new dentist and juggling my life at home with being a mom. And therefore, I would say, really, I didn't know what coaching is. I didn't use a coach. Had I known what a coach is and how a coach can help you through these struggles, I would have definitely been in a better place personally. I would have been more happy at that time. And my struggles would have not seemed as big as they were seeming to me at the time.
Well, being a new mom and running a business and having 12.99%, that's there's a lot going on there. Wow, this was some great stuff. Again, thanks so much for joining us, Dr. Hariri, the founder of VIL Coaching. Go to Deals for Dentists to find her promo offer of 20% off the first 2 life coaching sessions. And wow, this was some really great stuff. Before we wrap things up, any last words of advice for the young dentists out there?
Yes, I want to say, get help in whatever it is that you're stuck in. It doesn't matter who you choose. Make sure it's a good fit and they're working for you. And if they're not, you can always choose somebody else. But I would say, don't do this alone when you can get help. I would also say, you know, uh, treat your patients as you would your family members. Continue to learn throughout your career. There is so much reward in learning. I was in the same place for 14 years. And when I changed the structure of what I was doing by using a coach, by going to a lot of meetings to offer more to my patients and be more knowledgeable for my patients. Knowledge is power. The more we know, the more we are able to help our patients. We don't know what we don't know. So it's really a good feeling when you feel that you have the ability to really see what's going on in your patient's mouth versus not being able to see a lot of things that we just don't know, because we in dental school we really can't be taught everything. We're given good foundation to get out and practice, but we have to continue growing. And I would also say always practice with integrity. Don't put money first. That should always be your first goal. Integrity. Do the right thing, the money comes. And in closing, I want to really compliment you on the Deals for Dentists company and what you're really creating here for dentists. I want to say this is a great idea that you are now doing this for dentists, where they could come and find deals and find these offers on your website. And these podcasts are super helpful. And I know that there is more to come that you're working on that's going to be so beneficial to young and even midway, halfway in the journey for dentists. So I want to compliment you for really taking the time to also invest in doing something good for the profession. So
Thanks so much. Thank you so much. And I think that's such great advice that you gave there. And I think this interview is going to resonate well with a lot of dentists out there. But let's be in touch, and let's find out what's new in your world in the next 6 months or so, and get back in touch with each other. Again, thanks so much for joining us.
My pleasure. Thank you for having me on this podcast, Eric, and best of luck to you.
You as well. Take care.
Thank you. Take care.